I'm a volunteer with Association for India's Development, Seattle chapter. The first time I got introduced to AID and the Seattle chapter team was during MILAN 2017. So my journey with AID in the past 3 years had brought tremendous personal growth. It has exposed me to concepts of justice, equality, privilege, and inclusion with a brand new lens. So for all those who are new to our organization, AID was founded in 1991 with the idea of understanding and solving problems that plagued India. Since then, the organization has grown to 36 chapters in the United States with more than 1,000 volunteers. So for today's agenda, we'll begin with our esteemed speakers who will speak for about 10 minutes each. I kindly request all of you to please mute yourself when our speakers are presenting. We will start with Anjali. She will talk about the migrant workers and issues of food security. Then we have Kiran, who will tell us about the livelihoods and rebuilding for farming communities. Next, we'll hear from Anil, who will talk about the situation in Mumbai and the relief efforts there. And finally, Abhay will talk to us about the conditions of public health system. After which we will open the call to a Q&A session. I will request all of you to please keep sending your questions in the chat box. And during the Q&A session, you can use the raise your hand feature on the Zoom app, and we will invite you to ask your question to the speaker yourself. Also, please find the details in the chat on how to donate today and how to reach out to us if you want to mail in your donations. The AID Seattle chapter team meets every Friday over Zoom for our weekly community service hours. You can join us and learn more about our work with other partners from India. We are a really fun and passionate group of people, so it'll be fun. Our organization stands for Sangharsh, Seva, Nirman, courage, commitment, and change. I have the honor of introducing to you the person who started all this and imbibes all these with his work and life, Ravi Kuchimanchi, the founder of AID and an inspiration for the movie Swades. Ravi had a vision that problems are interconnected and so must be the solutions. And this thought of his has helped thousands of people in India. This is relevant more now than ever. In appreciation of his efforts, Ravi and his colleagues received the Times of India Social Impact Award from the Indian Prime Minister in 2011. He continues to be the source of inspiration for so many of us here today. Let's hear from him. Ravi, please.
Thank you, Deepti. Of course, the work of AID, primary people in the work of AID are the people at the grassroots in India who are the people from the village themselves. And then, through the social activists and the volunteer base here, AID connects with the person who is, the prime agent of change in a village or in a situation which is ordinary individual who is like fighting with all their strengths. And we see that ordinary individual in the migrant workers whose pictures have been splashed in New York Times and all across the media when they are walking several miles from Mumbai back to their villages. We see the strength that an ordinary Indian has. We see the courage that an ordinary Indian has to face problems such as COVID, to face problems such as hunger, to face problems such as government inefficiency. And it reflects that picture of those migrant workers reflects to me the strength that India has. And it reflects also, reflects what we need to do. Of course, the failure of India is also reflected by that picture because of the way the lockdown was done, which forced the people on the ground without using. India has one of the best transport systems in the world. We can transport millions of people every day, and failure to use what we best have at the most crucial juncture in history, when millions are going to be stranded on the COVID crisis. While it's a failure at the top, it also shows the fight that India can put up at the grassroots. And I believe that we are at a defining moment in history with COVID and with the crisis in India. Our partners for change are the people at the grassroots and the civil society groups with whom we work. And I think now more than ever, if AID volunteers' time and effort, if the support of the community here, if the if the activists in India, many of whom are present in this call, if all our work mattered all these years, in the next few months and in the next couple of years, it would matter even more, because we are at that defining moment in the history of our country, a country in which we all grew up, a country which has done so much for us. It is that country that is potentially facing probably a tenth of it or a hundredth of it getting exposed to COVID, getting infected with COVID. And the ensuing death rate would probably top the US, which is currently at 1 lakh. There is no sign of this easing. The government is going, like blindly and so on. And therefore we are at that moment that we need to outdo ourselves, and contribute what we can. And I think the broad contours of what needs to be done are very well known. They are well tested and tried. It's how we implement them in the future that matters. AID would respond, like Deepti said, with creative work where, for example, right now, I'll also talk a little bit about the work that our people who are not present on the call are doing. Like, for example, Balaji has moved from the initial rehabilitation in Tamil Nadu. Now they are trying to identify people and supporting them small loans of 3,000 rupees each, so they can restart their businesses, whether it is selling vegetables and so on, because the loan sharks, right now the interest rates being charged here are about 10% a day. The daily, like if you wanted to take a loan to start a vegetable business, to restart your vegetable business, you would give a daily interest rate of 10% today. So the contours of creative change like that, to billions of dollars being spent by the Indian government through its PDS system, through its NREGA, through various programs, for which it has to be held accountable through cases in the court, through advocacy actions, where 8 partners have made an impact, to holding corporates responsible. This is also, the time is ripe, for the disadvantage to be taken more advantage of instead of to be taken less advantage of. And therefore it's a time where we have to come down heavily to see that our healthcare and our loans and our various, the private agencies which also support India, not just the government agencies, are also held accountable and are held to their limits. So with that, I would request Sai or Suren to play a short video that our team has put up, and after that I will introduce our first speaker, Anjali. Yeah, thanks for playing the video. The approach that AID is taking, so this is a multidimensional challenge, and we have an approach of combating food security. I mean, of combating hunger through food security, of of responding to the plight of the migrants, as well as livelihood. So that is one regeneration as the economy opens up. And our first two speakers would speak on that issue, and then the later two speakers would speak on the health crisis and what AID is responding. Anjali Bharadwaj has been associated with AID Seattle for the last 9 years. So it's a partnership with AID Seattle that we treasure. And Anjali is an activist, is a well-known activist who has been working on both right to food and right to information. She is the co-founder of the Satark Nagrik Sangatna, and she is also the winner of the Ashoka Fellowship. She has been responding to the migrant crisis and also has been advocating, for the underprivileged through the justice system in India, through the courts. So it would be a pleasure to welcome you, Anjali, and thank you so much for your wonderful work. And you can unmute yourself and,
Thank you very much, Ravi, and everyone at AID and AID Seattle. I hope I'm audible.
Yes.
Yes. So essentially 90% of India's workforce is in the unorganized sector. So when we had the lockdown, which was announced in response to the COVID-19 crisis, what ended up happening was that we saw that a very large proportion of these people who are migrant workers, who work in the unorganized sector, work very often as daily wagers, earning a basic minimum wage every day, they found themselves out of jobs. And what we saw and what have really become the defining pictures of the lockdown in India are all these people walking back to where they came from because they lost all livelihood opportunities. Now, it is very critical as a background to recognize that these people have very small savings. So whatever little savings they had very quickly disappeared, and they all live on rent most of the time in places like Delhi, in other areas where they go to work to seek employment. So people recognized very quickly that without any employment, they would have no way to pay their rents, they would have no way to provide food for themselves and their families, and they would very soon be hurled into homelessness and destitution. So there was absolutely no way to stop these people from going back unless they were reassured that they would be taken care of and they would not be left to sort of fend for themselves. Unfortunately, when the lockdown was announced, there were no packages that were announced for such people. No economic package was announced simultaneously, and that exodus happened. Eventually, when the PMGKY, the Pradhan Mantri Garib Kalyan Yojana, was also announced, it wasn't adequate. It did provide for some food for people, extra food for people who already had ration cards, but did not provide any wage support. Across the world, we have seen whether it is developed countries in Europe, the US, Canada, or it is even underdeveloped countries like our neighbors in Bangladesh, there was wage support that was announced. But unfortunately, nothing of that sort was announced in India. So people had really no way to take care of themselves and their families. With the support of AID, we have been working to do things at 3 basic levels. One is direct support where people have required it, because very quickly people fell into a situation of food insecurity where children, people were having to go to bed hungry. And we responded to that by providing people cooked food where they didn't have any way of cooking food left either, and otherwise providing dry rations. But a very large part of our efforts was also on advocacy, on working with the governments, pushing the governments to really recognize the scale of the problem and to respond. So one thing that has been constantly advocated for is universalization of food supply, of the public distribution system. Under the National Food Security Act, people are given ration cards, but very often migrant workers and the most vulnerable are left out of that security net because they don't have their address proof, they don't have Aadhaar cards very often, they don't have the kind of documentation that is required to get a ration card. So it was absolutely essential that governments respond by universalizing the ration system. And that's something we pushed for as part of the National Right to Food campaign, as the Delhi Rozi Roti Adhikar Abhiyan that we are part of. And the Delhi government did respond. There were about 1 million families, rather 1 million people who were included to be given rations by the Delhi government. But when we undertook monitoring, social audits, we recognized that there were many people who were still left out of the food security net. We also recognized that ration shops very often and in many places were pilfering rations and people were not getting the ration that they were supposed to get. So we approached the Delhi High Court where a case was already going on, and we pleaded and we said that this needs to be immediately looked into. The High Court has been very supportive, and the court has given very strong orders which have been complied with to a very large extent as well. So one of the things that the court has said is that no needy person should be left without food. So as a result of the court's orders, the Delhi government now has expanded ration system to about 5 million people across Delhi. So already Delhi was giving rations to about 7 million people, and additional 5 million people are now getting the ration supplies during the COVID period. Also, the High Court took very strong notice of ration shops being shut and pilferage happening, and ration shops have been ordered to remain open all 7 days of the week. Their records have been asked to be put out in the public domain so that people can themselves monitor and make sure that they are getting the rations that they are supposed to get. The third sort of thing that we have been working on with support from AID is really looking at the institutional framework to make sure that people have the wherewithal to be able to access their rights, their entitlements, and the benefits that they are supposed to get during this time. We know through our experience of the right to information that unless people have information in India, because we have corruption, we have a leaky system very often, benefits and rights that accrue to them under government programs don't actually reach people. So people need information. Unless there is information in the public domain about how much stock is reaching ration shops, about who's getting the ration, how much stock is available, they do not get the rations that they are entitled to. So one of the things that we have been focusing on is greater transparency in government programs. There is a lot of information that people need, not just about rations, but about pensions that they're supposed to get from the government, about healthcare. There are many unfortunate reports going around that people have to run from pillar to post with COVID positive patients looking for beds because they don't know where the beds are available, where ventilators are available. People need that sort of information. And again, information about the very large funds that have been set up in India. The PM CARES Fund, for example, has been set up. Now there are about $1 billion that have been collected, but nobody knows where the money is coming from, exactly how much is the money, where it is going, who are the beneficiaries to whom it is going. And unless all that information is in the public domain, people will not be able to get benefit from there. Similarly, CM relief funds have been set up. The Prime Minister had announced a 20 lakh crore budget for economic relief. Again, people need to know the nitty-gritties, the data about that, so that they can actually be public scrutiny and people can go out and get their rights and entitlements. So just very quickly, I will wrap up by saying that going forward, we think that even as the lockdown is being lifted, there will be need to provide direct support to people, because the economy isn't going to come back on its feet immediately. People are not going to get the jobs that they lost in many cases. So direct support in terms of food, in terms of some kind of cash, etc., it will probably, healthcare will probably be required. Apart from that, it is important to keep ensuring that governments do not pull back the rights that they are giving people during lockdown, like food security. There are 80 million tons of food grains lying in the Indian granaries. They must keep coming to people to ensure food security. So advocacy for that, for minimum wages. We have approached the Supreme Court. Earlier, the petition was dismissed, but we have again gone back as interveners in the matter where Supreme Court has taken suo motu cognizance of the plight of migrants. And most importantly, we will continue to work on the institutional framework that empowers citizens in a democracy, so that people can actually participate, scrutinize, and make sure that they're being able to get benefits and entitlements and rights from the government that need to accrue to them. I'll stop here.
Thank you, Anjali. It was like awesome to hear about the achievements, and particularly the case in the Supreme Court and the other court orders for which millions have already found benefits that you have been able to achieve. So one of the things that I was remembering was my conversation with Dilip, which Dilip sometimes reminds me of. I think a few years back, Dilip asked me, what is the one thing in your mind that a person, that the common person in India needs? And I said that that person actually, the one thing if the poor need in India is an advocate who can sue in the courts of India, because that is the biggest change that you can make. And Dilip often reminds me that this is what my answer was to his question.
I've shared that quite often, Ravi. I've shared that statement quite widely.
So now you see the evidence of that, Dilip, from what Anjali has shared. So that also reminds me to tell you all, because many of you have contributed to AID Seattle over the last couple of years and several years. Last year, AID Seattle raised about $250,000, through which it supported a lot of projects, including agriculture. And of course, Kiran is a familiar name in agriculture for AID Seattle, because Kiran is somebody who is a Jeevan Sathi of AID. He came to the US, way back in the late 90s, after doing his electrical engineering at IIT Chennai, to work on his master's and PhD here. But having discovered AID and volunteered for it and being in its board, Kiran decided to go back to India to work with the farmers. And at that time I was thinking, what can an electrical engineer do for agriculture? And literally he opened a new direction for AID to work on, which is the agrarian crisis. And Kiran, if many of you recall, talked to us about a helpline that they ran for farmers in India to address the agrarian crisis, right? And with COVID, they used the exact same idea and started a COVID helpline in Telangana and Andhra Pradesh for migrant workers to contact them. So Kiran will tell us about the helpline, and now that the immediate crisis of migrants seems to be addressed, we are moving in India to rebuilding, and as the Indian economy is also opening up to the livelihood creation stage. So Kiran, can you take us from agriculture to the helpline to livelihood creation?
Thank you, Ravi. And it's very nice to be with the whole AID Seattle group, volunteers and the supporters. Like Anjali said, basically the zone, which is a parallel crisis to the COVID disease itself, which Anil and Abhay would be talking about. So in essence, India is starting the of COVID as well as.
Kiran, you're breaking up a little. with your, yeah.
Right. Let me try this. Is it better now? Okay. Right. I was just saying that due to the lockdown, the crisis of migrant workers as well as the poor people, and unfortunately, many of the state governments also took quite a long time to, wake up to the realities of the migrant workers as well as the food crisis and the shelter crisis and so on. So one of the first initiatives that we did in AP and Telangana, both states, is to start which is also supported by Seattle. And now in the COVID lockdown situation, we could not have any call center kind of setup, but we just put out a call for volunteers. There are about 50 volunteers signed up to take calls. So we set up a system where remotely any call that comes to our helpline can get routed to any of these 40, 50 people. And they were all taking calls, and it was like kind of a day and night thing, starting from 7 a.m. to midnight, kind of a call center. And we handled about that the last time we counted, and in the process, we were able to help about 30,000 people directly through food and rations. Distributed almost 1.5 crore rupees, was spent from various sources. Some part of it came from aid, but we also leveraged, so many came forward to provide that kind of help. And because we were running this helpline, we got to know different pockets of various kinds of problems which are happening both in rural and urban areas, and were able to either respond through civil society or bring them to the notice of the government. And like Anjali was saying, basically advocacy for making sure that the government support reaches the poor is often the most important element in so emergency relief. We were also, working with the government and pushing them to actually give ration support to the people. In the initial round, the government was able to support only half of the migrant workers. But then through our helpline, we brought to the notice of the government various pockets of migrant workers. And they did a second round of, support to about 1.5 lakh families. Which is kind of a result of the advocacy of all the civil society groups. And in the last 1 month, we've been helping thousands of people to get back home because they wanted to go back to their home states. So this whole entire work was possible through the helpline. But now actually the crisis of livelihoods is the thing which the poor are facing both in rural and urban areas. And since our core area is working farmers, just question, Deepti, is that okay?
Ravi, Kiran, you keep breaking here and there. I think either you can leave the headphones or don't hold them very close, because as your hand moves, the voice changes.
Okay.
Let's try
this
that.
Is better?
Yeah.
So the so since our core area of work actually is working with farmers and rural livelihoods, because we did a survey at the beginning of May of the impact of COVID lockdown on the farmers, and we found that there was a serious impact because when the lockdown was imposed, it's the time of the Rabi harvest, harvest of the winter season crop, which includes and what happened was that the farmers were not able to harvest crop in many places because of the lockdown and absence of workers. Where they were able to harvest, they could not take it to the market, and they were not able to get good price. So we found that almost 10% of the crop could not be harvested. About 25% loss in price, because of the lockdown situation. So essentially, it kind of wiped out the entire earnings that the farmers would get from those crops. And then about 35% of the income for any rural household actually comes from this. Since the lockdown happened, work opportunities as well as the employment guarantee work, the NREGS work, also did not happen properly for those 2 months of lockdown. So there's a serious loss of wages. And then the people from the rural households who were in the urban areas, they got stuck in the, they couldn't send back waste to their families back in the villages. So that actually has created a big economic crisis in the rural areas. Unfortunately, the package that's announced by the government actually doesn't address this. There was a serious need for substantive cash support for the rural poor as well as urban poor, which has not come through. So that crisis continues. So now going forward, what is happening is that we need to actually look at the upcoming season. You know, the rainy season has started. And need to actually invest and start their agriculture.
Again, Kiran.
Hmm?
So I think it's the bandwidth. Yeah.
Is this better?
Yes, yes, Kiran.
Better than you say, it is better.
Sorry, I think there was some problem with the audio thing, which we did test, but maybe something went wrong. So just to conclude, I think basically what we are looking at in terms of livelihoods, especially rural livelihoods, is that farmers need support for enabling them to do agriculture properly in this season, because they had lost an entire portion of their incomes for the previous season, so they have very little cash left, which means that timely loans and substantive banks, cash schemes which are in operation in many states, but a lot of times the really small and marginal farmers do not get access to these things. So some of our work in the villages has been focused on ensuring that the small and marginal farmers get access to the bank loans and the other cash support schemes which are there. And this work becomes all the more crucial because of the COVID lockdown situation, the impact that they have faced. It was working only in 3 or 4 districts, but now we have actually expanded to the entire state. Our lockdown helpline, now it's working in the entire state, so we can actually get a ready flow of what is the problem situation on the ground. As dynamically the situation keeps changing, so the helpline is going to run, and we are going to respond and bring things to the local government. And thirdly, the employment guarantee program, which is also important, the NREGS program, because many of the migrant workers who come from the rural areas to the urban have now gone back to their villages, and there are many more workers now than they would normally be, because of this entire crisis that's happened. So the Employment Guarantee Act becomes more important. And another issue on which we are working is the farmers' collectives, so that they can actually collectively market and get good prices in the market. So that's also very important. So there are 4 or 5 things that we are going to focus on as far as the rural livelihoods are concerned. So I just wanted to end by saying that essentially when you look at the migrant crisis and the enormous, like 8 crore migrant workers is what the latest central government estimated, and even that we feel is an underestimate. The reason so much of migration is happening is actually because of a rural livelihoods crisis. And now that people have gone back to the villages, actually many of them don't want to come back to the cities because of the hell that they've gone through. So therefore, it's all the more important to focus on the rural livelihood scenario and improve and provide job creation opportunities, processing units, and so on in the rural areas, so that the desperate migration, the distress migration that happens to the cities actually is reduced, and we can have a better model of economy going forward in the future. That is what our focus is going to be. Thank you.
That's great, Kiran. Thanks for telling us about the awesome work that you're doing. I apologize for a little bit of problems with the audio, but it is very heartening to see that the helpline is now expanding to the entire state of Andhra Pradesh and Telangana, which was in a couple of districts before. So that's really good, and also as the season starts, the agriculture season starts, the support that Kiran's group, as he's also the founder of the Raitu Swaraj Vedika, can give is incredible. And that also brings me to the point of telling that aid volunteers across the US have worked very hard to raise about $600,000 so far for COVID relief work, and we hope. But of course, in India, we are still not south of the curve. The graph is still growing, and the worst is still to be seen. So we'll now hear about the health crisis in India, which is going to be coupled to the livelihood and the hunger crisis that Kiran and Anjali have talked about. So you can also switch to the speaker mode. I think Diti has been asking me to mention that. So you can toggle between the speaker mode and the grid mode if you wish. And that brings me to introduce my good friend from Mumbai, which is like the New York City for COVID right now in India. Of course, Anjali in Delhi is also facing a similar COVID crisis. So it's a competition now between Delhi and Mumbai. So Anil, he's an entrepreneur and he's a businessman who supplies medical equipment, and he was in a very good position to respond to COVID. And Anil is also a socialist. He's a Gandhian. He has an enormous amount of volunteer, incredible amount of volunteer contribution that he makes. I think more than anybody else, Anil has been on the field for responding to COVID personally. So he goes out of his house 12 hours a day into the slums of Mumbai, giving people rides. His response started with aid, supporting Bombay Sarvodaya Friendship Center and Helping Hands for addressing the food crisis in the migrants. So started by distributing food packets. Now, we even without thinking, they are cooking for about 10,000 people a day. They are running these community kitchens in the slums of Mumbai. Anil has a mother at home and he has a daughter at home, and still he is out of the home 12 hours a day in the last 70 days. And Anil has been visiting also the hospitals in Mumbai. He has been aid has been supplying through Anil PPE kits for a clinic called 1 Rupee Clinic, which actually is the clinic that is doing the tests in the slums of Mumbai and bringing out the impact of COVID in the slums of Mumbai. So, and he's also distributing the protective gear, and now they're also into training in the hospitals in Mumbai. So Anil will, and our next speaker, Abhay, will speak about the health crisis. Anil will talk about the direct experience in Mumbai in the last 70 days. Anil, please focus on the health aspect because the other aspects, have already been covered.
I'll start with a good news. After 70 days, all the main members of my team decided to go in for a test, a COVID test, and we have all come negative. So COVID has not been able to get to us so far. So that's the good news. Or I don't know whether it has already come and gone. There's no way they couldn't tell us that. But then we're all currently negative. So that's the good news. And then coming to the health situation here, even in the best of times, Mumbai's healthcare is very, very stretched. Most of the public hospitals are located in the island city. As many of you know, Mumbai is a city made out of 7 islands. And then there are many suburbs. Can you hear me? Can you all hear me? Yeah. So we have many suburbs where most of the population in the city lives. So it so happens that all the major medical colleges owned by the government are within the island city, and most of the hospital beds are within the island city, but the people live in the suburbs. So there's a mismatch between where the population lives and where the hospital beds are. So even in the best of times, you don't get beds when you want them to. In fact, when my wife wanted to deliver the child, there were no beds available in the hospital where we booked a bed well in advance. The situation is like that. And our fears were proved correct when COVID happened. The Mumbai Municipal Corporation did not do any preparations to get ready for handling the disease. We had 2 months lead time because we knew what was happening in New York, where there were no beds, there were no ventilators, and where dead bodies were lying outside on the road. And Mumbai didn't do anything to get prepared for it. And now already we are just about maybe a month or month and a half into the pandemic, and we already are facing a very, very dire situation. The BMC is one of the richest municipal corporations in the country. It has an annual budget of about 30,000 crores, and it has a corpus in terms of fixed deposits in the banks of about 66,000 crores. But unfortunately, for the last many years, there has been no investment on expanding infrastructure at all. Most of the healthcare budget goes towards payment of salaries of the fixed salaries of the doctors and staff and all that. So that's the sad part of the story. If you look at the population in the city, it has a humongous population, almost 15 million, and then 60% of Mumbai's population lives in slums with very little hygiene, with little or no healthcare facilities, even in normal times. So what happens is now within a month, we have more than 1,000 cases which are coming up every day only in Mumbai city. There are almost 20 to 25% of India's positive cases are in Mumbai city. And then when we started working, we started working on the field almost a week before the lockdown was announced. The lockdown started on 25th of March, and we started working on the field around the 17th or 18th of March. And at that time itself, we thought that there's going to be a big shortage of trained manpower. So we started designing training programs for doctors and nurses. And then once the disease came to Mumbai, the first few cases came. In fact, we have never had to ask aid for any help. Ravi called me up and said that this is happening. So do you think we can send you some money? That's how our relationship with aid has been. And then we immediately started working on the field. In about 3-4 days, we were all there. We started distributing ration kits on one side and working on the healthcare on the other side. So in the intervention we have done on the healthcare with the help of aid is the supply of N95 masks, because we noticed that the main hospitals were taken care of pretty well. There were big donations which are coming into JJ, Nair, Sion, KM. These are the big hospitals. But then there are a lot of peripheral hospitals and rural hospitals where nobody ever bothers. So we started servicing those hospitals. We started distributing N95 masks to the nursing students, to the resident doctors, because when there's a shortage of trained manpower, you always look at the students. In fact, now Mumbai has officially recruited 3rd year and 4th year students, MBBS students, to fighting COVID. It's like that. They might have never seen a patient in their lives, but then they have already been recruited to fight as staff in this pandemic. So we were giving N95 masks, we were giving face shields. These were computerized 3D printed face shields at a very cheap price. We sourced them and we started giving face shields to the doctors. And then the PP kits, when the PP kits came into the country, they were very, very expensive. The imported ones, they cost as much as 3,600. So we sourced good local manufacturers, meeting all the specifications specified by WHO, and for as less as about $5 to $8 or so, we can even get a good PP kit available. So we've been giving PP kits to doctors and nurses. And then we tied up with 1 rupee clinic, which was a very interesting concept. This was a small startup company which wanted to have doctors in every railway station, so that for 1 rupee, they could diagnose, they could treat patients. So we tied up with 1 rupee clinic to do mass screening across Mumbai, everywhere. So they would go door to door, screen people. So we gave them pulse oximeters to do that. We gave them infrared thermometers to do that. And then now they're doing the COVID testing also. Whenever they screen people and find that somebody has symptoms and has fever, they would then do a COVID test on him. So that's one of the reasons why Mumbai is up there. If you really ask me, probably every city in Mumbai is having the same situation, but Mumbai is doing the testing, and that's why you see that there are so many cases officially announced in Mumbai. And then coming to the training programs, what the municipal corporation has done is it has recruited almost 25,000 doctors and nurses from the private sector or retired doctors and nurses into the mainstream now. And these people have to be trained in the next few weeks, because we are going to peak maybe sometime in end July or something like that, and we need a lot more people. Today there are no quarantine beds available, there are no hospital beds available, there are no ventilators available. So you might have to convert one flat, let's say in every apartment, into a small quarantine center, into a small hospital, and you need manpower there. So we are now trying to address this situation. Tomorrow we are starting the training of 150 nurses in Thane. And once we do this, we are going to train 500 nurses in Mumbai. So this is a part of the program that we have drawn up. And Last but not the least, we are also going to supply a few ventilators to hospitals which really need it, because the rural hospitals and all, many of them have not seen a ventilator. So we have tied up with a local manufacturer of quality ventilators at maybe 25% of the cost of what the imported ones do. And we want to make this available to the hospitals. We also want to make a few educative films. There's a lot of wrong misinformation and taboo on COVID. It's treated on par with HIV AIDS. If somebody has is test positive in a building, he's treated like an outcast, and they don't allow them inside the building. In fact, just before the Zoom call, I had a desperate call from a friend of mine who said that a person, elderly person in his building who had tested positive and who was treated and now is negative, the other people are not allowing him to come back into the building. They say, we don't know, you might show us a certificate that you are negative, but we don't want it to come to others. So they're not allowing him into the building. So I asked him to go and file a police complaint. So we need some films, short films to be made to drive this into people, that it's like a normal cough and cold, and you don't have to be so scared about it. And we are putting our efforts in making a few films, maybe one real film and one animated film in our mind. So I think I'll stop at this, and then I'll continue when the question answer sessions happen.
Thanks so much, Anil. So yeah, that's a thing of some of the work that that Anil has been doing in Mumbai. I think to take further, Anil has given us like the acute response, right? Like, I mean, the immediate response to the health situation in Mumbai. Our next speaker, Abhay Shukla, is from Pune, and he also has been working with in rural Maharashtra and in Madhya Pradesh for several years. He's the most senior partner in this call. Of course, Medha Patkar is probably the most senior partner. Abhay is the most senior partner of AID in this call. And Abhay, Dr. Abhay is graduated from All India Institute of Medical Sciences. He is the convener of the Jan Swasthya Abhiyan. And some of the work that Abhay has done, which we have also personally seen, like for example, when I visited some villages with Abhay, to hold the primary health clinics accountable to the people, simple things that they did, like just showing to the people what saline was and what a saline injection is, and that they can even taste it, to remove their myth from saline injections, to putting the attendance sheet of doctors and nurses of the primary health clinic, and asking the people to tick when they attended and when they, on the days in which they were present and the days in which they were absent. Making these kind of things transparent in the health sector, it achieved so much. And so without further ado, I introduce Dr. Abhay Shukla, who would give us a holistic perspective on health, both related to COVID and going forward. Abhay?
Yeah, thanks a lot, Ravi, for introducing me. And it was great to hear about the work being done by the other speakers, and especially by Anil, because it's in Maharashtra, in Mumbai. So yeah, I will be speaking about other parts of Maharashtra besides Mumbai, where, of course, as you know, also the epidemic has spread quite widely, and what are the health impacts, and also what are some of the responses which probably need to be further strengthened and upscaled. So next slide, please. So as you probably know, Maharashtra is the state which is the worst affected by the COVID-19 epidemic in India, and the number of cases and the number of deaths are roughly 35%, or roughly 1/3 of the entire cases in the country, and it's far ahead of even other large states like Tamil Nadu and Gujarat, Rajasthan and MP, and of course Delhi. So this is the kind of situation which we have, but within this, next slide please. Within this, the distribution is actually quite skewed. Now, if you see the pie chart on the left-hand side, this was in mid-April. just 4 districts of Maharashtra, which is basically Mumbai, Mumbai Suburban, Thane and Pune, essentially 2 large urban clusters of Mumbai and Pune, they accounted for almost 90% of the cases, 88% of the cases. And then another 8 districts which are more urbanized and which have large urban clusters or cities, they formed about 9.5%. And the whole rest of Maharashtra, which is 24 districts out of 36, were contributing barely 2.5%. So this is the situation about 1.5 months back. And now we have, as of today, the number of cases has spread to these 8 districts and also to the 24 districts beyond those, which means that basically we are seeing a gradual, slow diffusion of cases to rural and small town areas of Maharashtra. And this trend is likely to continue. So in fact, after the epidemic has peaked in Mumbai and Pune, we are expecting a large number of cases in rural areas and in smaller towns across Maharashtra. Next. Now, what has been the health impact in these areas of Maharashtra? Now, as Anil pointed out, public health services have traditionally been underfunded in Maharashtra. They have been understaffed. So they have been really overstretched. And they are fulfilling multiple functions: testing, surveillance, contact tracing, and of course, quarantine of various kinds, and also curative care. And in each district, a large number of public hospital beds have been reserved for COVID-19 care as COVID hospitals or as COVID health centers. And in this process, we have seen that there has been overloading of public hospitals with COVID-19 care in places like Mumbai. But outside of Mumbai, it's not so much COVID-19 care which is overloading the hospitals, but rather the fact that because of the diversion of beds for COVID-19, there is reduction in access to other kinds of care for a whole range of other what we can call non-COVID patients. And that has been the main problem in most other parts of Maharashtra. And not only serious issues like cancer dialysis, but also very routine healthcare situations like deliveries are, sometimes not being able to get adequate care because of this diversion of the beds to care for COVID patients. Next. Now, in this situation, I would say that, public health services have largely tried to rise to the challenge of the COVID-19 epidemic. So over the last few days, I have been trying to locate cases of denial of patients in public health facilities. And we have a large network of Jan Arogya Abhiyan and community-based monitoring. And so far, I have not been able to locate any major serious case of denial of care in public health facilities. Now, this is interesting. I'm saying this as a health rights activist who's spent the last 25 years documenting cases of denial of healthcare in public health facilities across Maharashtra and other parts of the country also sometimes. So what I would like to say is that actually the public health system is, although it is overstretched and understaffed, I would say at least out of Mumbai, our understanding is that it is largely coping with the situation, although with some problems, as I have already pointed out. It's not a very great situation, but 80% of the clinical care to COVID-19 patients is being given by public health services, although 70% of healthcare in Maharashtra is given by the private sector. So this tells us something that is going on, that actually the public health services, which have been traditionally understaffed, have stepped in, and they are taking the lion's share of the care in COVID-19. And combined with this, the civil society groups have played a major role in providing immediate relief in the form of food, shelter for migrant workers and various other groups. And this has kind of partly filled in the gaps of where the state has been less effective, especially on the migrant worker issue. Next. Yeah, and in contrast, the private sector has been missing in action. And, this is a case which was just a week back in Thane, where a young woman who was in labor, she went to 3 successive private hospitals. All 3 turned her away, and finally she, along with her baby, died in the auto rickshaw. You can see her photograph. So this kind of denial of care by the private sector has been on the rise. And also there is massive overcharging by some private hospitals. Certain private hospitals in Mumbai have been charging up to 1 lakh rupees per day. Even if it's not at that scale, it has been really on a high scale. And because of this, the state government has been finally forced into some action to regulate the rates for COVID-19 care and medical procedures, and also to extend the state health insurance scheme to larger sections of the population. So, but we are really seeing a kind of a contrasting situation where the public health system and civil society, in different ways, of course, have stepped into action, whereas the private sector, in many cases, with some exceptions, of course, there are some charitable doctors, some NGO kind of setups which are also doing great work. But on the whole, the commercial private sector has not really been playing a very great role. Next. Now, this is something which we, along with our partner organizations, have started doing because it's our understanding that we need to support public health services, but at the same time in a way that ensures that people get their health rights. So in Kolhapur district, in one of the blocks, we found that our partner organization there called Samvad, which is associated with our network, they started a help desk in the public hospital because there was huge overcrowding. People had all kinds of queries and questions and doubts and anxieties which needed to be rationally answered. So they started regularly sitting in the public hospital, providing information to people, facilitating care for them, and also ensuring that wherever people needed some higher level care, they could access that. So this was started in one rural hospital and extended to 2 other PSCs. Large number of persons have been provided guidance, and now we are actually thinking of extending this to something like 150 PHCs across the state, where our network of community monitoring is active, and also giving information to people about their entitlements in the private sector. Next. Yeah, so this is my last slide, basically indicating what are some of the things that we'd like to do. Right now, I'm not going into the long-term responses which are required. If you're interested, there's an article by myself in the scroll in 2 parts, where we have talked about, what are the 10 lessons that we can learn from the COVID-19 epidemic in India. So right now, I'm just talking about some of the immediate responses, where already we are in a discussion with AID, and so one is setting up these civil society help desks and patient or citizen information centers in something like 150 PHCs across 17 districts in the state, and also facilitating access to care through local information collection and feedback, some kind of rapid response system, and also monitoring the provision of care by private hospitals which are enrolled in the Mahatma Phule health insurance scheme, to ensure that they provide the free health care which they're supposed to do, and also that rates are capped by the private hospital as has been ordered by the government. And of course, we continue to track the epidemic by our Maharashtra Public Health Analysis Group, and we are trying to also suggest modalities for better control of the epidemic, which may still not be considered adequately by the government. So I'll just conclude here, and I can probably respond to any questions which may be there. And you're also encouraged to see the scroll article, which I think Nirvik is sharing the links for that. Thanks.
One second. Hello, can you hear me? Okay, I'm unmuted. Sorry, I thought I was muted. Thanks so much, Abhay, for presenting what's needed next for COVID and the kind of work that is being done in Maharashtra. And I'm also reminded yesterday what Anil was sharing, that the test positivity rate in Mumbai right now is 30%. So 30% of the people whom they're surveying are testing positive in Mumbai. And so both for COVID and non-COVID, the response to health, is something that we need to, that AID needs to really gear up on. So as we have heard from Abhay and other speakers today, there are a lot of proposals to AID and a lot of partnerships we have to build. The crisis is exploding in India, so everybody's support is crucial. I think Deepthi has shared the donations link in the box, and I want to,